Okay, that's good. Of course, we just have started to use it for 3 weeks, and I was excited about, the whole process. We have some slides here which demonstrate basically how it works. But overall, it's a gentle examination procedure. It's a quick procedure. It has many advantages in terms for the patient because I can really save some time because I have one measurement to do for several of my required measurements in cataract and refractive surgery. It seems that the precision is pretty good. Of course, we just have 3 weeks follow-up, and that's not based on study, it's just on the first impression we got. But this measurement procedure on one axis seems to have major advantages. Well, there are several devices out for us. That's great. Industry has provided us with good options and many options. But of course, we want very good equipment. Now, this is a German company. Usually, I'm very happy with products from our nation. But what can I say? The next thing, I think, you need high-class equipment, very good equipment. When I look at the measurements, you also, in the world of today, where we have so many measurements to take, it's very important that we shrink down our instrumentation by time, because otherwise you have 5 instruments in one room and get 5 measurements. If I can put measurements in one equipment, which obviously the AXL Wave does, then I have a major advantage. So this is for me, really good advantage. Then I also think that because we worked many years with the equipment from Oculus, with the Pentacam, with all versions, and we always got very reliable results. So I'm very happy about that. Well, at the moment, first of all, maybe the people need to understand, you get here several measurements. You have biometry. Well, we start with tomography because that was the original idea of the machine. Then you added biometry, and now we're adding refraction. We're adding a retroillumination effect or measurement, and even the aberration. So you have 5 different measurements, which per se can be done in different machines. So we do this all in one machine, and of course then I have it on one axis, making a picture, very reliable, comparable to each other, or making the measurements comparable to each other. And that's exactly what I want. Now, scientific evaluated with many published data over the years, we have found always very good results so far. And of course, we're comparing it also to other machines. Well, I think that the Scheimpflug technology per se, the PCI technology, is the way to go. I mean, these are old times of ultrasound measurements are over. Only occasionally we need to do this, but this is a major advantage which I do. And also have this opportunity to have different displays. And different displays, for example, all my cataract patients, where I can have a view on the interior surface of the cornea, the total refractive corneal power, which seems to be important since we know that the posterior surface has an impact on astigmatism. Having displays, having basically on several displays a lot of information, including with the old Pentacam, basically, including axial length measurement and the anterior chamber depth, the corneal thickness. These are all numbers which I use for my evaluation for my patients. And now, even now, I can add the aberrometer. I can add objective refraction. And this seems to be in our first study on the first 20 eyes, seems to work pretty much good with the refraction we're doing. So it seems to be a good measurement device for incorporating a lot of these different tools we had previously. Well, I think that it's basically, the company has worked for many, many years on taking these measurements, which I just explained, and put them in several screens. And the screens are very important to, for example, to look at form fruus keratoconus patients. We want to figure this out for refractive surgery. We want to have a screen which gives you the idea about this. This compares then to a normal population, for example, one feature where we really can say, all right, this is a cornea which is suspicious. Maybe we don't do corneal refractive surgery, just a better phakic IOL, for example. So these features are important. It's also very important for my staff because early in the beginning they have these overall screening modalities in 7 areas, for example, in cataract and in refractive, so that we really can go right into the patient and say, do we go the right path? Do we have to do all the examinations? Do we just make a first interview with the patient and say, sorry, you have another problem. We need to put you on another area. You have a form fruus keratoconus, no refractive surgery. You need other treatment. So these screening tools, these screening displays are very important.